Today, we have 142 new cases of COVID-19 have been diagnosed, including 3 epidemiologically linked cases, bringing our total number of cases in British Columbia to 11,034. That includes 3,974 in the Vancouver Coastal Health Region, 5,800 in the Fraser Health Region, 239 people in the Vancouver Island Health Region, 587 people in the Interior Health Region, 345 people in the Northern Health Region, and 89 people who generally reside outside of Canada. We now have 1,494 active cases in the province in all health authorities, of whom 74 are currently in hospital, 24 of whom are in ICU or critical care. We have no new deaths to report, leaving the total number of people who have died from COVID-19 in British Columbia to 250. There were 3,683 people now who are on active public health follow-up, and 9,257 people who are recovered. For the 142 cases, there were 9,016 laboratory tests processed yesterday, giving us a percent positive rate of about 1.5%. There are no new healthcare outbreaks to report today, and 19 active outbreaks in our healthcare system continue, including, 17 of which are in long-term care or assisted living and 2 in acute care facilities. We now have 921 cases in our healthcare system, including 533 residents and 388 staff. We have 1 new community cluster to report today in the Interior Health Region at the FedEx office near the airport. Public health teams are on site and are working with the business there, and contact tracing is underway. There is no risk to those in the public who are picking up packages, and there's contact tracing underway right now. And in addition, please check with each of the health authority websites about other community exposures. Oh, excuse me. Got something in my throat today. So today, as part of our ongoing provincial monitoring for COVID-19, health teams have been paying careful attention, as you know, to children who might be hospitalized with what has become a new syndrome that is sometimes associated with COVID-19, and that is the multisystem inflammatory syndrome in children, or MISC as it's known. And we have been following this for some time. Initially, we were only reporting confirmed cases, but in the summer, we changed our monitoring to report cases under investigation to be aligned with both the Canadian and the WHO case definitions, and to make sure that we could monitor all of the children who might have been affected by this. We have had 16 children who have been under investigation. None of them have had any positive laboratory tests that would indicate they were associated with COVID. And today we did have 1 child, our first confirmed case of MISC here in British Columbia. This is a young child under age 5 who has been diagnosed with MISC once their serology test came back positive for COVID-19 this week. The child has fully recovered and is now at home. And to date, we, as I mentioned, have had 16 children who have been assessed for MISC but have not had any association with COVID-19, and are, in the assessment of the pediatricians, much more aligned with what we normally see with Kawasaki syndrome in children. Again, also a relatively new syndrome that's associated with infectious illness in some cases, and it's, we think, though we're not entirely sure what the cause of it is, both MISC and Kawasaki syndrome are associated with inflammatory processes that happen in the body, particularly the blood vessels, after a person has been infected with viruses in many cases. And we will continue our ongoing monitoring of any child who's hospitalized with the symptoms that meet the case definition, and our pediatricians at Children's and Women's Hospital have been an incredibly team of experts who've been supporting children and parents around the province to make sure that we have this, that we understand what is happening here with this. So today as well is International Handwashing Day. So I do want to take advantage of that to remind people that the simple act of cleaning our hands can make a big difference in our lives, making sure that we are protecting each other and ourselves from COVID-19, but also for many other illnesses, everything from the things that cause stomach upset to influenza. And this is our time to remind people that take a moment to refresh your good hand washing techniques and habits. Make sure you wash your hands when you come home after you've been outside, if you've been touching things like on transit or in the school, cleaning your hands before you eat, before you touch things and put them in your mouth, making sure that you're not touching your face are important as well. And soap and water is the simplest way to wash your hands, and we need to do it for 20 seconds. It works by mechanical action, so making sure that you use the soap, you get your hands wet, you lather them up, and then you wash them and rinse them under running water, warm running water. For those, for times when soap and water is not available or a sink is not available, alcohol-based hand sanitizers can take that place, particularly if your hands are not visibly soiled, and they get rid of those transient bacteria and viruses that we can pick up by touching things in the community. So remember, wash your hands for at least 20 seconds with soap and water and dry them thoroughly. And if soap and water is not available, then alcohol-based hand sanitizers can stand in. Another important preventive measure for everyone is, especially this year, is to ensure that everyone gets the influenza vaccine. Vaccine supplies are starting to come in here in BC now, and we've started to distribute them around the province. I want to reassure everybody we have sufficient vaccine supplies. There's been no problems that we've identified with the supply that's coming in. The supply chains are strong, and there have been no delays in the manufacture of the vaccine this year, so that's good news for all of us. The optimal time to be immunized is in the coming weeks. So if it takes a week or two for you to get an appointment with your pharmacist or your physician or you're at your public health clinic, the best time to do it is end of October and into November, and that's where we get the maximum protection through influenza season. So I want to reassure everybody that the supplies are coming into BC and are being distributed around the province and will be in the coming weeks. We also monitor very carefully for influenza and do this every year here in BC and across Canada. And the influenza, so far, rates have been very low in our community. So we're not yet into that season. So we have time to make sure that everybody who wants it can be immunized in the next few weeks. And so monitoring influenza, it's still low, and we want to keep it that way. And we keep it that way by doing these important protective measures like cleaning our hands regularly and being immunized for influenza. So as we know, everyone in BC has a role to play in our COVID BC response, and no more so than as we move into this respiratory season. What you do helps everyone around you as well. And these simple steps like washing your hands regularly, getting our influenza vaccine, can make all the difference to us, our families, and our communities across BC. So please do your part today to help protect our communities this fall and winter. And of course, we need to continue to do this, to care for each other, to connect with each other, even as we take those measures that keep us physically apart, and continue to be kind to each other, to be calm and understand that this part of the storm can be challenging for many, and we need to do our own bit to be safe.